Partial knee replacement really is an exciting procedure for patients. It's not the right procedure for every patient, but is a good solution for a lot of patients. And when we think about total knee replacement, I think it's important to understand that a total knee replacement really is a resurfacing of the entire joint. So we're placing a metal cap on the femur, a metal cap on the tibia, and then there's a piece of polyethylene between the two pieces of metal. It's really a resurfacing, though, of the entire joint. Partial knee replacement really is designed for a very specific wear pattern and resurfaces only one specific part of the joint. And there are essentially three parts of the joint that we think about: the medial, the lateral, and the patellofemoral compartment. A partial knee replacement really resurfaces only one of those compartments. It's a great solution for a lot of patients who have what we call unicompartmental wear, which means one compartment is worn out, their whole knee is not worn out. It tends to be a little bit less invasive. It is a little bit more normal feeling knee than a total knee replacement. It preserves more of the natural ligaments of the knee. But again, I think it's not right for every patient, and it really have to come in and have an appointment and let your surgeon figure out what is the correct procedure for you. I view partial knee replacement as probably a much more complicated procedure than total knee replacement. Making half of an artificial knee work with the rest of your knee really is much more complicated than just replacing the entire knee itself. And so it really melds well with robotics. Robotics is perfectly designed to help us implant that partial knee perfectly. Deciding whether a patient needs a partial knee or a total knee replacement depends, I think, on a lot of factors. The first thing is the wear pattern. And if the entire knee is worn out, the patient will not do well if you only replace one side of the knee. And so the primary determinant is the wear pattern. The second thing is, where is the patient's pain? And some patients have more global knee pain, and some patients have very specific knee pain. In general, I think the patients who have very specific knee pain that correlates with a unicompartmental wear pattern, only on one side of the knee that is, those are the patients best suited for partial knee replacement.